CNA Fall Prevention Bed Alarm Use. Welcome to the quiz. Question 1. You are providing end-of-life care. The resident's respirations are very noisy, often described as a death rattle. What can you do to help ease this symptom and provide comfort? Option A. Position the resident on their side to help drain secretions from the mouth and throat by gravity. Provide gentle mouth care with moist swabs to keep the mouth moist. Reassure the family that this sound is common and does not appear to cause the resident distress. Option B. Suction the resident's mouth and throat frequently to remove the secretions causing the noise. Option C. Offer the resident a small sip of water through a straw to help thin the secretions. Option D. Tell the family to try to ignore the noise, as it means the end is very near. The answer is A. Positioning and mouth care provide comfort. Explaining to family reduces distress. Option A is correct because positioning on side allows drainage and mouth care provides comfort. Option B is incorrect because frequent suctioning can be traumatic and may not be necessary. Option C is incorrect because giving water to a dying resident may cause choking. Option D is incorrect because telling family to ignore is insensitive. They need explanation and reassurance. Question 2. A resident has a new cast on their lower arm. What is the most important sign of circulatory impairment to watch for and report immediately? Option A. The resident's fingers on the casted arm are pale, cold to the touch, and they report numbness, tingling, or increased pain not relieved by elevation or pain medication. These are signs of compartment syndrome. Option B. The resident says the cast feels heavy and uncomfortable. Option C. A small amount of dried blood on the edge of the cast from the procedure is normal and expected. Option D. The resident says the cast feels warm and itchy underneath. The answer is A. Pale, cold fingers with numbness indicate circulatory impairment, a medical emergency. Option A is correct because pale, cold fingers with numbness/tingling indicate impaired circulation, which is a medical emergency. Option B is subjective and not emergent. Option C is normal post-procedure. Option D is normal, itching under cast. Question 3. While helping a resident put on their shoes, you notice one foot is significantly swollen, red, and warm to the touch compared to the other foot. What should you do? Option A. Do not put the shoes on as they may be too tight and cause further issues. Report the swelling, redness, and warmth to the nurse immediately, as this could indicate a blood clot, DVT, or cellulitis. Option B. Put the shoes on as best you can and note the swelling in your charting at the end of your shift. Option C. Tell the resident to elevate their foot on a stool while sitting to help reduce the swelling. Option D. Massage the swollen foot gently to help reduce the swelling and improve circulation. The answer is A. Swelling, redness, and warmth could indicate DVT or infection and require immediate reporting. Option A is correct because these signs could indicate a deep vein thrombosis, DVT, or infection, which require immediate nurse assessment. Option B is incorrect because ignoring could delay treatment. Option C is incorrect because elevating may not be appropriate without knowing the cause. Option D is incorrect because massaging a potential DVT can dislodge the clot. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. A resident has a do not resuscitate DNR order in their chart. You find the resident unresponsive and not breathing. What should you do? Option A. Check for a pulse. If no pulse is found, begin CPR, as a DNR order only means no intubation, not no CPR. Option B. Call a code blue and begin CPR until the team arrives. Option C. Do not start CPR. Immediately get the nurse and stay with the resident, providing comfort and support. Your role is to ensure the resident's dignity and comfort in their final moments, as per the DNR order. Option D. Begin CPR immediately, as that is the standard response for an unresponsive, non-breathing person. The answer is C. A DNR order means no resuscitation efforts should be made. Option A is incorrect because DNR means no CPR. Option B is incorrect because it violates the DNR order. Option C is correct because a DNR order means no resuscitation efforts should be made. Option D is incorrect because it violates the DNR order. Question 5. A resident who is a fall risk insists on walking to the bathroom by themselves. What is the best way to balance their safety with their right to autonomy? Option A. Explain your concern for their safety calmly and offer to walk with them or provide a walker, saying, "I'd feel better if I could just walk with you to make sure you're steady. It helps me do my job and keeps you safe." This respects their wish to walk while ensuring safety. Option B. Let them walk alone but watch them closely from the doorway, ready to intervene if they stumble. Option C. Restrain them in the wheelchair with a lap belt to prevent them from getting up at all. Option D. Tell them they are not allowed to walk alone and activate the bed alarm to alert you if they get up. The answer is A. Offering assistance respects autonomy while ensuring safety. Option A is correct because it respects the resident's desire to walk while ensuring safety through assistance. Option B is incorrect because watching from a distance is unsafe. You need to be close to prevent a fall. Option C is incorrect because restraints require an order and are not a first-line intervention. Option D is incorrect because it restricts autonomy and may not prevent a fall if they get up. Question 6. What is the proper technique for counting a resident's respirations to get an accurate rate? Option A. Count for 30 seconds and multiply by 2, without the resident being aware, after pretending to take their pulse. This prevents them from altering their breathing pattern. Option B. Ask the resident to take deep breaths so you can count more easily and get an accurate rate. Option C. Count for 15 seconds and multiply by 4, as this is the fastest method. Option D. Tell the resident you are going to count their breathing and watch their chest rise and fall for 30 seconds. The answer is A. Counting respirations discreetly after taking a pulse gives a more accurate rate. Option A is correct because residents may alter their breathing if they know it's being counted, so counting discreetly after taking a pulse gives a more accurate rate. Option B is incorrect because asking for deep breaths alters the rate. Option C is incorrect because 15 seconds may be less accurate, especially if breathing is irregular. Option D is incorrect because telling them can change the rate. Great job! Don't forget to subscribe. Bye!